Okay, welcome everyone. My name is Stacy Davis, and I'm with Metropolitan Council of Community Mental Health Centers. It's a collaborative membership organization representing the public mental health system of community behavioral health centers serving the greater Kansas City area. We provide support to our member organizations and education, information, and resources to the public on accessing quality health services. We host the Kansas City Mental Health Conference in May, as well as provide webinars the second and fourth Thursday of every month. Please save the date for the Mental Health KC Summer Workshop focusing in on arts and mental health, which is going to talk about music, art, movement, and design to reduce stress, build connection, and support well-being. It's going to be held on July 9th at the Johnson County Arts and Heritage Center from 9:30 a.m. to 3:30 p.m. You can earn 5 CEUs, and the cost is only $20. And I put the link in the chat. Just a reminder that the views and opinions presented on these presentations are those of the speaker and do not necessarily represent the opinions of Metro Council. At the end of the webinar today, we will put the link and the password to get your certificate of attendance. Please remember to copy and save the link and password, because if everyone tries to get the certificate all at the same time, the site usually crashes. So we recommend that you get the certificate later in the day today. I'm excited to introduce Andrea Romer. She's going to present the hidden cost of being good, how helping professionals can share without carrying the work home. Andrea Romer is the co-founder of ARC Coaching, where she teaches healthcare professionals the emotional clarity, communication, and self-leadership skills that allow them to do demanding work without carrying the weight of it home. Please welcome Andrea Romer.
Thank you, Stacy. Welcome to everyone from Mental Health America of the Heartland. I'm going to share my screen, and I thought I had it ready, so let me make sure, as much as I plan, tech it can still be always something fun. Great. I hope that you can all see and hear me, and
Looks good. Looks good.
Great. You just let me know because I like a crisp audio. So welcome, and follow the instructions on the screen. And I put the links to these if you're on your phone in the chat. When I work with people in person, I love to balance the energy between me and you guys. And so I want you to know that I'm really imagining that we're all together in the same room. Most things I'm going to talk about today are a way to model self-coaching or communication in your world. I can imagine that you have expertise, skill sets built, and tools that you have built over the years or are building that are so valuable. And we just want to use our work today to build on those things. I'm from Wisconsin. The weather is gorgeous today. It's a beautiful blue sky. And I'm imagining that you're eating your sandwich at your desk and listening, or maybe you're at home with your kiddos who are off for the summer. I'm imagining your lanyard, and you're just really taking the time to do this for yourself. And so I appreciate you. Thank you for your work in the world as a human and for the work that you do. You bring life experience and context and big traumas and little traumas, all of that mixed up to this. And I just want to name how wonderful that is. Thanks for letting me connect with you today. So I love the dichotomy of this title. Our hidden costs are often our strengths that get overextended. And we're going to talk about that as we move on. And sometimes when we're overextended, it's because we're carrying what we think we shouldn't feel, a way of being, when we get to care for ourselves and for other people. We can care for ourselves, and that lowers our burden and it elevates our care. But we often haven't been taught that these hidden costs are our strengths overextended. And I love people's reaction when I do this workshop because it's very clear that yes, there's stress, there can be burnout. The system never changes, or the system is always changing. Test of change is slow. Yes, all of these things are true when we are helping professionals. And how we experience this work is what we are here for today. We are hoping for us to understand how in life's ups and downs, how we support ourselves during that is to see what life is going to throw at us. Just like the people who are experiencing healthcare, we give them tools in our work to be able to support their body and their mind as our tools show them how they're going to experience their healthcare and their journey. I don't know if I said that very clearly. One of the things that is my expertise is helping my patients and families and healthcare professionals understand that we give them medical tools and mental tools so that we can see how life is going to shake out. And that's really what we're here for today. Our learning objectives are to understand or be able to understand some of our thinking patterns. We'll also be able to understand how some of our thinking might be helpful or unhelpful. And also we'll be able to recognize maybe when we're carrying something from being overextended or caring where it's not going to be helpful. We're going to try to understand some of that today, and I'll leave you with some cognitive strategies, which even in this beginning, I'm hoping that our way of speaking can connect you to the compassion and care that you already give. So this is me. Some people like to see a little bit about me, spend a lot of time outdoors. I work and speak with a lot of groups. I work in an ICU as an expert communication nurse. And last week I was recognized for humanism in medicine. And what I'm hoping now is that since we probably all hate icebreakers, can you put in the chat? And I'm going to pull up the chat. Let me see if I can find that. Again, I don't know why I can't see it. Oh, there it is. I wonder, I may have to pause for a second, all of you. Thanks for bearing with me to pull my chat up and then share my screen again. So pardon me. I want to be able to see that because that's how we're going to interact. I understand that there are 100+ of you here, and this is how we are going to be robust. Nope, still can't see it. All right. Ah, there it is. I got it. So what I would love for you to do is put your role in the chat and either what's interesting about you or something that you've accomplished or been recognized for recently. The why behind this is that, oh, yes, keep it coming if you can. That is wonderful. And don't forget the second part. What's interesting about you? Accomplishments or recognition. Why this is important is because it teaches people how to communicate when they see you do this. We are all very humble in our own ways. And if people report to you, transparency is them seeing you being vulnerable, saying, hey, I've been led to do this. You can do things too. If you report to someone, sharing your wins, accomplishments with them helps them talk to their bosses. Communication is a loop that we get to use to be human, to make humanism work for us. Oh, I'm loving all of this. There's so many different things here. Ooh, wow. Wow. I'm so impressed by everything I'm seeing here. The world is so full of so many people doing so many amazing things. As you can imagine, many of you and the roles that you have, I work with those type of people on a day-to-day basis, and it's just such an honor. I can name that when I was recognized last week for humanism, my husband said, "You made yourself so small there." And I said, it felt available there to be small, but I feel it expanding in me as the week has gone on. All right. I love this. To stay in our time, I do want to keep moving, and I can imagine that all of you are good at fill in the blank here. And the system does not always reflect the good work you do. And oftentimes, the ship turns slow. The way that we do good work and get recognition can't always flow back to us, or we haven't been trained to hear the cues. Our brains and our bodies are always looking for the things we can improve on. And I hope to recognize that we can practice recognizing how good we are at the things that we do, even the good things where we get overextended. So, in a moment, I'm going to have us talk about the good things that we do. But I do want to share a quick story about this. Last week, I was working with a mom whose son had a motorcycle accident, and I had a couple things in my mind that I wanted to connect with her on, that I wanted to make sure that she shared understanding with me about that. After 10 minutes, she said, "I'm so thankful that we shared this time. I'm way less anxious." I could feel my brain trying to say, "Not enough. That's not recognition. You didn't meet all the outcomes." Maybe you can connect with a situation like that in your mind, or a circumstance like that now, and really practice moving forward, letting that be enough. This is how we train ourselves to not just wait for the system to show us. I'm not telling you not to change the system, but sometimes we have to take it back to ourselves. I had a client tell me recently that when they started working with me, they thought they were going to find out how bad they were, and they found out how great they were. And oftentimes, business and systems don't show us the results we want as quickly as we wish, and we don't have to wait for that. We can reflect on what people say if we listen to the clues and we embody it in our mind, embody it in our body, and we recognize how we think about that and pay attention to that. This is an exercise you can do with people who report to you, or patients or clients as well. So I can imagine that there's someone in your mind that is a mentor, or someone that you really love working with, or some qualities of yourself that you really love. If you could do this instruction on the screen, that would be great. We've understood how the hidden cost can at times be our overextension of our good qualities. We're going to talk about that now. Let's first identify what the good qualities of helping are. What are you really good at? Oh, yes. Keep it coming. Our work comes fast. There's an endless amount of work and clients and patients, and getting to focus in on these qualities is amazing. Wow, amazing things here. I love the participation. Keep it coming. What I love is that I can learn from what I'm seeing here. You guys can see what each other are good at, and that's so valuable. So I put some qualities here, and as you're putting yours there, sometimes this is how we have this hidden cost. Is our compassion can turn into some fatigue, and our responsibility can turn into a little over responsibility, or empathy to exhaustion. And that is human. That is how life and work are supposed to be. Maybe supposed to is the wrong word, but this is how we're going to experience life. But I like to help us understand, and I'm just seeing good listener here, good listening, and sometimes we forget to listen to ourselves. And so what I want to do is help you understand that when you get into that spot of I'm listening, I've only been listening, how can I listen to myself? How do we turn compassion back to ourselves, or responsibility back to ourselves? And as we practice this, thinking about, okay, what costs am I experiencing? Are they overextension of me? Then we turn back to ourselves. And oftentimes that starts to happen more quickly. I want to pause here and see if I can be clearer about this, or if I can answer any questions. All of these things that you're mentioning are the things that you're going to continue to be good at, and the things that we are going to continue to have feelings about and overextend, and that is all part of life. Remembering our story, remembering our skills, helping clinicians and people understand how their current story intersects with what you want for your life and for your work. That's really what we're doing here today. Even in giving me these things in the chat, you're defining the story of who you are as a human in your work. And what you're doing, and maybe you haven't named this, is you're helping patients and your clients and their decision makers understand how their healthcare, their mental care intersects with the life they want for themselves. So that's really what we're doing here, is creating stories for ourselves. So we are going to, in the simplest way, now start to talk about the framework that I teach and use a lot with people that I haven't taught here. Yes, I see a question. How do you continue these helping behaviors and not get burnt out? That is a great question that I think we're always all asking. And we're going to look at a framework today that can help us with that. And I think the question becomes, how do we take these helping behaviors and identify how they help us get what we want and what we need? And maybe some of you can mention how you help with your helping behaviors without getting burnt out. So in the simplest form, some of you might be trained in where the brain thinks all of its thoughts. But one thing that I focus on with people is understanding their stories, which really come from their beliefs or thinking. And belief systems are the guides that drive our lives. I think we can see that playing out in many parts of the world today. And when we haven't been trained to recognize that beliefs are our thinking, and therefore we have these being fluid throughout our life, sometimes we have beliefs that come from when we were much younger or in a different part of our life, or we're unaware that these can be fluid with us. There are two kinds in the most simplistic version of thinking that brains do. And the first type is ticker tape. If you want to write that down, That is the automatic thought that runs through the mind that we are unaware of that happens so frequently. When someone cuts us off in traffic, sometimes we have an automatic thought like, this could be harming us. And we also have, I'm behind, I should do more, they're disappointed. There are a lot of flavors of those ticker tape beliefs that run across our minds frequently. The second type is an underlying belief, one that has been a well-practiced neural pathway for some time that we begin to treat as the story of our life. And it can be deeper than what happens to us on a day-to-day continuum at work or at home. It could sound like, I'm not enough. My worth comes from achievement. I'm responsible for other people. We can even start to think about how the language of helping behavior leads us to burnout plays for us. I love that we brought that up right away. And we can plug that into the framework that we're going to talk about here in a minute. But some of the things that I talk about with many groups, whether it be doctors, nurses, leaders, is we do have some beliefs that we carry along that you can't do this work without being burnt out. That burnout is something that shouldn't happen, that it's not necessarily something that we expect to happen, and we help ourselves with our thinking and our stories and how we're going to manage that. Lots of thoughts about things. So if you had downloaded the link or scanned the barcode, this is the self-coaching model. This is a foundational tool that I'm trained in using and helping people with that changed my life a decade ago when I was going through a period of burnout and overwhelm. I had a lot of things that I wasn't aware about in how my brain worked. And this was one of the things that I rely on currently and then to help me make sense of what was happening in the world around me. This was I was trained in this and taught this from Brooke Castillo, and it's really a way of organizing. The components of this model are very simple and clear. So much sometimes that I question myself about why I can't use this more or why I'm unaware of things that happen in our brain. And that is life. The things I can say are that I used to believe when I was younger that eventually I would get to a place in my life or my career that I wouldn't have ups and downs. When I work with my healthcare professionals, oftentimes when they come to work in the ICU or in the clinic, they're really attuned to, we are going to save lives. And we have people that do die. And that can be hard to recognize that we, through healthcare and mental health care, give tools that help people support their body to see what their body or their mind are going to do. Just like life is going to continue to have its ups and downs. Using this model is not a model that can help us control life. It helps us understand how we can experience the way that life presents itself to us. So we're going to talk about each piece. I want to check my time, and here we go. I welcome you doing your own work on the side as we go through this, just listening to the examples that I have. I'm open to any questions in the chat. If you're working with me, you would get something like this if you wanted to use this as a tool. So we're going to begin with circumstances, which are facts of life. As we talked about, life is going to continue to have its ups and downs. That's not going to stop. And We often think we can control that and we can't. I like a temperature because it's a fact and it's easy to see. 60 degrees. In a minute, we're going to do an exercise to understand the difference between a circumstance and our thinking. That was one of the biggest challenges for me starting to use this model. I think that we can all understand facts. When I start working with groups, we start here. And what I also teach is that our circumstances, we can decide on these. After we learn how to use this, sometimes a circumstance becomes something that initially we talk about as being a thought. A thought is that belief that runs through our mind. Now, this is from my Florida family, 60 degrees. This is cold. When I'm there, this is cold. Now in Wisconsin, when it's 60 degrees, people put on shorts. But when it's 60 degrees in Florida, I'm always thinking this is cold. What I want to do right now is do an exercise in the chat. I'm going to give us a little quiz, and I'm going to give us about 10 seconds each to weigh in on what you'd like. So I'm going to share a sentence, and I want you to recognize like C or T in the chat. The manager asked me to meet with them at 4 p.m. Is that a circumstance or a thought? Oh, yeah. I am falling behind. My coworker ignored me. Yeah. You know, a circumstance can be words that someone said, a quote, or words that you are quoting or thinking, if that's helpful. My coworker ignored me is thinking, which is so fun. The meeting is at 9:30 a.m. That's an easy one. I should know what to say. You guys are all spot on. My husband is late for work. Oh, I love that everyone says that's a circumstance. Oh, that is our thinking. Now, if I said my husband leaves for work at 9 a.m. or needs to be to work at 9 a.m., that could be a circumstance, but late is always thinking. This just helps us get a perspective of how much our brain can run its own ideas. And late is something that I work on with a lot of people because late always feels a certain way, which we're going to talk about in a minute. Even if he's legitimately late. Well, our brain sometimes runs late based on what we're observing. Sometimes, because of how the word late correlates, it's not always helpful or useful for us because of how it makes us feel. And all of that is subjective. And this is where we get to play around with this model to recognize. That's where I love this. He's still home at 9:30. Then it becomes communication. I'm identifying he's late. How is that making me feel? And that's why this is so important. And then how do we communicate about that? And people get to be late. That is always a fun thing too that we work on. You guys are also smart. These are nuances that I love to get into. I want to make sure that we use our time. Yeah. How about this one? No one appreciates my work. I like what you said. Late doesn't necessarily mean judgment. That is amazing if that works for you. But recognizing how shared language works with people is also interesting, and how everyone shares different models, and how this helps us understand the world around us from how we experience it. I love all of this. My email has 47 unread messages. Yes. And as you take this with you today, you can use all of this however works for you. It's helping us understand what's helpful or unhelpful, nourishing, not nourishing. Great job on that. My daughter said no. Yeah, yes. And here's the last one, which I think you guys will get. Everyone else has figured it out but me. So the thoughts that we have about the circumstances are always how we are experiencing the world. I think it's very fun. But now we're going to go into the meat of the work that I do with people, which is feelings, emotions, which are sensations in our body. And this is just a random model that I use a lot. Feelings are vibrations. And when you stub your toe, you stub it, it goes up to your brain. And this is a simplification to just reorient us to this for ourselves. When you think I'm coming off stupidly, you feel embarrassed, it goes from here to here. What I work on with folks is how to process and allow emotions in real time, and to recognize that some of the pain that we feel in life is judgment of the feelings that we think we shouldn't have, can't have, will be judged for, or will make us over the top, irrational, or too emotional to work. So a lot of that is our judgment of emotions. What I have come to believe and recognize is that we will continue to have a life of 50% feelings we consider good and 50% bad. And don't think we can get out of the 50% that we may not want to have sometimes. And how does that give us a lens of how our thinking creates our feelings? And all of those feelings are just incredibly present for us, sometimes more than once. The cliche that all the feelings are valuable doesn't always feel good, because they don't feel valuable sometimes, but they are going to happen. And they start with how we observe or think about the circumstances of life. We often believe that how we feel will start to change or be all one type of feeling as we move through life. And that's not always the case. And we also tend, now we're going to talk about actions, to take actions because of how we want to feel or avoid feeling. And I do that. So I like to emphasize that. But I want to pause here and see if anyone has questions about how we have a life circumstance, Then we have an observation or a thought or a belief about it. And then we have a feeling. And if you're working this out on your page by you, great. Great. I can never promise that people leave completely settled. I can imagine that they leave with their minds open. So how we feel creates our actions. Now, in this model, you get one circumstance, you get one thought, you get one feeling. Actions could be many. Sometimes you get inaction as well. So it's 60 degrees. I think that's cold when I'm in Florida and I feel sad. I don't go to the pool party. Actions are driven by our feelings, and we will act, react, or not act based on how we feel. And there can be many feelings happening at the same time in our body. And the result is that my plans got cold. Chilly plans. But results are determined by our actions, and what we do will always create our results. And they usually mirror what is happening in the thought line of these models. And remember, our results are not about controlling our life, or not necessarily the result of our life. It's the result of the experience that we're having in our mind and body as we go through our life. Any problem can be categorized into the model. And this doesn't mean that we have to micromanage every thought going through our mind. What this means is that we have a way to be curious that's safe and clear, and we have a way to observe what's happening with our experience. Once you've seen something in the model, it's clear which thoughts are causing certain feelings and actions. The brain always wants to prove something to be true, and it will look for that evidence. We typically ask people to imagine that we're broadening what evidence we're looking for by understanding how we're thinking. That's why we did the exercise of hearing the good things we do, naming what's interesting about us, naming our accomplishments, because we want to begin to broaden what our brain gives its attention to. Our results will always provide evidence that support our thinking. That doesn't mean any thinking is bad. It means we can understand how we're coming to this experience. Are you willing to be wrong? By challenging your thinking and being open to the possibility, you can adopt new ways of thinking. So I want to pause here and I want to ask, what is a feeling that you avoid as much as possible? Put that in the chat. Uh-huh. Oh, yes, yes. Keep it coming. Yeah. Mm-hmm. Yeah. I think we're probably all nodding, like, yes, yes. Yes, yes, yes. Now, name the emotion that you want to have the most, or maybe you do have the most. Yeah, yeah, yes. Mm, yeah. And sometimes we have all of those feelings happening at once. I can imagine that you all have a way of processing your emotions, naming it as a color, where you feel it. Is it moving? Those are all ways to identify. Do I have multiple things happening at once? What am I thinking about this? All questions you can ask yourself. So now what we're going to do is just see a random model here, but talk through how we can plug and play a little bit, or how we can start with the end in mind. Now, this is really random. A Tuesday workday for me is usually 7 to 4:30. And I sometimes am thinking I'm compassionate, and I can feel very present with that. And that means I am attentive to myself and others. I take my breaks. I finish work, which doesn't mean I finish everything, and I care for myself. And how that shows up is, as a result, is compassion shows up in my day. And you can certainly see how you can play around with this. And if you ever have questions, you can find me on the Googles. So now let's think about filling empty spaces. So carrying a hard thing, which we were talking about, the hidden cost and carrying things home. Sometimes that's an action, and we can understand how we get there by being thoughtful about our thinking. We can find those thoughts usually in 5 minutes, just by giving ourselves 5 minutes to just write down let our brain spill out what's there. That sometimes carrying a hard thing is an action. Sometimes you could put that in the result line. Sometimes that's a feeling of advocacy, or we were talking about dedication or commitment. And sometimes we want to take that action of carrying a hard thing. I'm not judging that we shouldn't be carrying hard things. It's how we plan our models when we're doing that, so that we recognize, like today, I'm making a choice. Making a choice to do something that's not comfortable because I'm going to take the action of carrying this hard thing. Sometimes we want to feel compassion, or we do feel compassion. You don't have to always start with the circumstance. Sometimes you can recognize what you're thinking more than you're feeling. Sometimes you can recognize your feeling more than what you're thinking. There aren't a lot of rules, except keep it in this order, and only one in each line except for actions. Sometimes the result we want is caring for others, and we have to decide, how am I going to think and feel about this? What's going to take me there? Sometimes we're thinking, I carry hard things, and it's not an action, it's an observation. And how we feel about it creates our actions and our results. Sometimes how we feel about it is that we're martyrs, and the action is that we carry a huge backpack home. We're like, I'm not setting it down. I'm dedicated to this. And if I waver from this, then I will lose my momentum. Sometimes there's things to look at there. Sometimes we feel caring, even on a Tuesday. I better watch my time. Well-being. I want to name that being is well-being. What I'm working to do with the people that I spend time with is to help them broaden what being is, so that we don't think that if we're feeling upset, feeling hopeless, feeling challenged, feeling disempowered, feeling learned helplessness, feeling sad, that isn't part of well-being, because the work that we do is going to come with all of the feelings. So, as promised, I wanted to talk about a couple other cognitive strategies, and one of them is the meaning that we make, the story we tell. You only get to run models on yourselves. Even though I want to take all my husband's models, I love you, honey, and fix them for him, it's not mine to do. I can only understand how I'm thinking about him. This is low-hanging fruit, and it's always a great reminder for us. What meaning am I making here? And is it mine to carry? And how can I care for myself here? You might already be thinking of something that comes to your mind. Now, if you have things to share, I welcome in the chat how you have thought of this or used this. Emotional labor. I recently did this with your group, and you can read the definition on the screen. Invisible labor, we do a lot. We work in a profession where it always comes with people's emotions. And we get to understand how we might be carrying or trying to solve for someone else's emotions, and they just get to have that experience. And that's okay. And that's okay that we're figuring this out. But we spend a lot less time carrying the emotional labor when we can recognize, like, I am only able to influence my feelings. Likely how someone is feeling is from a circumstance, and it's not from me, and it's how their models are playing out. We really want to cut down on our invisible emotional labor, especially when I work with emergency departments. When people come into the emergency department, they have a lot of emotions about what's going on with their body. Then there's the emotions of you have to wait. We're going to do painful things to you. We're going to admit you. You're not going to be able to eat. What we do is separate that experience to how the professional is going to have emotions about seeing that and providing that care and being themselves as a human in this. And that means we plan 10 minutes ahead of time for this. We get what we need. We plan recovery for this. We do less emotional labor, which opens up time for us to do things for ourselves, to do the things that are important in our lives, and gives us space to do the work we want to do and be good at it. Evaluation versus judgment. Evaluation is timed, 5 minutes, filled with facts and action items. What went well? What didn't work? What will I do differently? Our brain loves judgment. It's cyclical and never ending, that isn't timed and doesn't come with an action item. And this is a great reminder for even myself to remember this. This is a great cognitive strategy to share with people that report to you, that you work with, that you report to. And I work on this a lot with healthcare professionals. So, what result do you want? We're not going to walk through this together now because we're at the end of the presentation. However, you can work that model from the bottom up. It is fun. Now, this doesn't mean that life is going to stop having ups and downs or that you can control everything that happens, but start with an intention, a result for the day that you want. What actions are you going to have to take? How are you going to have to feel to take those actions? And what maybe do you have to be thinking? What I have found is that I'm very surprised how I can support myself well. And in doing so, I get to be present for people's stories. I get to be a good helping professional that gets to help myself not carry things home as much. Oh, and I did want to name that if you can start to use this really well, not judging yourself is a superpower. It doesn't mean that you're going to miss things that you do wrong or be a doormat. What it means is that you're going to have so much more space for more of your human characteristics to come through. I'm so excited for you to start using this. So start with your end in mind. Start to play around with this and start to have so much fun. Well, I cannot thank you enough. And remember, we wanted to understand our thinking patterns, which this gives you an opportunity to do that, process through this. We want to understand what's helpful, nourishing thinking versus what's unhelpful or no longer true, or might be not true now. We need something different now and might come back in with ourselves later. We also want to understand what we're carrying. Do we want to carry it? are we caring beyond what we have the expansion and capacity to do so with our strengths? And then we're leaving with some cognitive strategies. So I hope that you get to have so much fun with these that just get to help you expand your humanism. And thank you for the caring work that you do. I'm going to open this up for questions now, and you can find me on the Googs or all of these places. Thank you.
Oh, thank you, Andrea. That was wonderful. That was an excellent presentation. We'll give everybody some time to type in their chats, any questions that they might have. We'll just remind you that this webinar was recorded and you can access it on mentalhealthkc.com or the YouTube channel. Um, I'm going to put in the chat where you can get your certificate of attendance, the password and the code. Please prevent the crashing of this site by accessing your certificate later on this day. Save the code and the information, and we'll give everybody some time to answer provide some questions. I also put in the chat the upcoming July 9th summer workshop and the link that you can join to register as a reminder. Okay, I will put that in the chat. It's called Mental healthkc.com or a YouTube channel can
Mm, I can share a link. Give me one moment. Okay, I'm going to put the slide link here. You should be able to access that. It has a public view. Well, as we're closing, I just want to name again, thank you for helping people understand how their healthcare and mental health care intersects with their lives, and keep remembering how your stories and your being help you create the life that you want and help with that intersection of the life that you want. So thank you.
Well, the next webinar is going to be the second Thursday of the month, and it's same time, 12 to 1 p.m. Hope to see you then. Thank you and all, and have a great afternoon.
Thank you.